Heart disease is the #1 killer of women, but having a diagnosis of heart disease is not a death sentence. If we diagnose it, we can fight it, and we can improve your health and your quality of life. We really want women to be their own advocates and understand what it takes to assess their risk. The first step a woman needs to take is to get heart checked. It's going to start with your personal and your family medical history, which may include the presence of a diagnosis of heart disease or stroke, the presence of high blood pressure, high cholesterol, or diabetes, and whether or not you had a pregnancy complication of high blood pressure, diabetes, or preeclampsia, which will increase your future risk of heart attack and stroke. It's really important next to find out whether or not you might be having any symptoms of heart disease now. These symptoms may include shortness of breath, chest pain, indigestion, lightheadedness, sweatiness, or a feeling of profound fatigue. We also want to know about your lifestyle. Do you smoke? Are you physically active? What's your diet like? What's your stress or mood like? Other factors to consider that are particularly important in women are whether or not you have an autoimmune disorder like lupus or rheumatoid arthritis, whether or not you underwent an early menopause before the age of 45, and whether or not you suffer from migraines with aura. These will all increase your future risk of having heart disease. After your conversation comes the physical exam, when your blood pressure, your waistline, and your body mass index will be measured. And finally, we're going to measure your blood sugar and cholesterol levels. Based on all those factors, we can measure your 10-year risk and lifetime risk of having heart disease.